I'll say Alzheimer's disease is the most common form of dementia. An estimated 5.5 million Americans live with the disease, and that's about 1 in 10 adults aged 65 and older. A new book defines Alzheimer's as a spectrum disorder, the spectrum of hope, an optimistic and new approach to Alzheimer's disease and other dementias. Details as a plan to help patients live more empowered and productive lives. The author is Dr. Gayatri Devi, and she joins us at the table. She's a neurologist at New York's Lenox Hill Hospital and director of New York Memory and Healthy Aging Services. Welcome back.
Thank you.
It's good to see you. I have to say, I think the title of your book is great because after you read it, it does give you hope. Many people think once they're diagnosed with Alzheimer's, they're just going to become a shell of themselves, and you're saying that is not true.
That's absolutely untrue. It's a myth. Alzheimer's is really a disease with multiple different presentations, multiple different courses in different people. It's as individual as the person who gets the illness. And many of the people with Alzheimer's live productive, functional lives in the community. And
most of them remain highly functioning, you say.
That's correct. And
give us numbers on that.
Well, basically 97% of patients with mild Alzheimer's disease don't even get diagnosed in their internist offices. And half of patients with moderate Alzheimer's don't get diagnosed. What that means is that the percentage of people that we think about when we think about Alzheimer's, the people in the nursing home, that's a very, very small fraction of the entirety of the people who have the condition. Most people live functional lives, can be treated. That's another myth, that treatment has no effect, and that's absolutely untrue. I've worked in this area for 23 years, and treatment does make a difference. Patients do benefit from it. It depends on the individual patient.
Why are 2/3 of Alzheimer's sufferers, people living with Alzheimer's, women?
So women seem to be at higher risk for developing Alzheimer's, even if you account for the fact that they live longer. We're not really sure why that might be. It may be because they are not succumbing to cardiovascular disease like men are at an earlier point in their lives. Also, there may be some hormonal influences. Women also present with different symptoms, so it's important to realize that their diagnosis may be missed. They may be diagnosed as having anxiety, depression, and unfortunately even hysteria. Menopause symptoms can mimic the symptoms of Alzheimer's, so it's important to make sure
what is the genetic element
that doesn't happen.
of Alzheimer's?
Genetics, people often think that genetics is the main determinant of Alzheimer's, and that's absolutely not the case. Less than 5% of Alzheimer's cases are from genetics. The majority of Alzheimer's can be prevented by lifestyle changes and modifications, simple things like diet. Make sure that you're eating a diet that's good for your heart, a Mediterranean diet, which is good for your heart. It's also good anti-Alzheimer's diet. Make sure that you are, your lifestyle, that you're active. Exercise 30 minutes 3 times a week.
If you do those things, you're unlikely to have Alzheimer's?
You can prevent up to 60% of Alzheimer's cases, yes.
Is there a test? Because I struggle with
controlled risk factors like high blood pressure, diabetes.
Is there a test that we could take or that we should take?
I think
so. When?
So I think everybody over the age of 50, just like we have baseline colonoscopies, baseline mammograms, we should all have a baseline brain evaluation, which includes a map of our brain strengths and weaknesses, so that down the road, if we forget, and all of us forget, and most forgetting is normal, then we're not going to get worried. We can actually look back and say, look, it's about the same as it was 10 years ago. Nothing to worry about. But if there's a problem, we can intervene earlier. The earlier we intervene, the better the response to treatment.
I really like the title of your book and about hope. So can you reverse Alzheimer's?
At this point, I don't think we can reverse it, but we certainly can stop progression. We can certainly treat effectively. And many of my patients with Alzheimer's are living in the community, functioning and enjoying their lives. And that's the purpose of this book, is to allow people to understand that there are many myths about Alzheimer's. There's much stigma surrounding it, but it's based on a fact that's not true. People think everyone with Alzheimer's go into nursing homes, and that is not the case. So, the majority stay in the community.
So are you suggesting that, with respect to others, that revealing Alzheimer's may not be in the best interest of the patient?
I generally tell patients and families to be careful about who to tell, because you don't want to be stigmatized. And we're all human beings, we're social creatures, and we're going to respond to how people treat us. So if people don't treat us as competent beings, which is sometimes what happens when they hear the diagnosis Alzheimer's, you're going to respond in a more diffident way. So I think it's important to be careful who to tell and how you tell, because I've had patients get fired from their jobs, and they're just as good as someone else who doesn't have the illness, and sometimes way better. Yeah.
Well, Dr. Gayatri Devi, thank you so much for this hopeful message. We appreciate it.
Thanks for having me on the show.
The Spectrum of Hope is on sale now. Former White House photographer